Ever feel like your mind is running on autopilot, stuck in a loop of stress, anxiety, or self-doubt? What if I told you there is a way to hit pause, rewind your thoughts, and unlock a calmer, more confident version of yourself? So today we'll dive deeper into what to expect during your first hypnotherapy session and introducing you to a groundbreaking program that I call Inner Centering that combines hypnotherapy, mindfulness, and heart-centered practices to transform your life. Whether you're curious, nervous, or just ready to take the leap, this video will walk you through everything you need to know. So let's get started. Hey everyone, I'm Dr. Anand, and if you're here, you're probably curious about hypnotherapy, or maybe you've already booked your first session and you're wondering what it's really like. Spoiler alert, it's not what you see in the movies. No swinging pockets, watches, no clucking like a chicken, and no, you will not lose control of your mind. So, what is hypnotherapy actually? It's a powerful tool that uses hypnosis, a natural trance-like state, to help you achieve a specific goal or goals like quit smoking, reducing anxiety, or boosting your self-confidence. Think of it as a deep dive into your subconscious mind where real change happens. But before we get into the nitty-gritty of what actually happens during a session, let's clear up a few things. So what do you need to know before your session? First, let's talk about the difference between hypnosis and hypnotherapy. Hypnosis is a state of focused attention and heightened suggestibility. It's a natural state of mind that you have probably experienced before, like when you are so engrossed in a book or movie that you lose track of time. Hypnotherapy is the therapeutic use of hypnosis to help you achieve specific goals. It's conducted by a trained professional like a clinical hypnotherapist, psychologist, or even a medical doctor. Now, you might be wondering, does hypnotherapy actually work? The answer is yes. Both the American Psychological Association, APA, and the British Psychological Society recognizes hypnotherapy as an effective therapeutic tool. It's been shown to help with everything from anxiety and pain management to breaking bad habits like smoking and overeating. So what happens during your first session? In your first hypnotherapy session, it will typically have three main phases. One, the introduction, which includes building trust and understanding. This is where you and your hypnotherapist get to know each other. It's a crucial part of the process because it helps your therapist understand your goals, concerns, and expectations. Sharing your goals, where you will discuss why you're seeking hypnotherapy and what you hope to achieve. Whether it's quitting bad habits, reducing anxiety, or just improving self-confidence, being open and honest is the key here. By assessing your needs, your hypnotherapist will ask questions to better understand your history, fears, and any challenges you are facing. This helps them tailor the session to your specific needs. And the hypnotherapist will try to explain the process. The therapist will explain how hypnosis works, what happens to your brain during the process, and what you can expect. They'll also address any concerns or misconceptions you might have. Setting boundaries is very important during this conversation. Your therapist will ensure that you feel comfortable and in control in all times. They may ask about your boundaries and preferences to create a safe and supportive environment. 2. The hypnotic process itself, relaxation and subconscious work starts once the introduction is complete. Your hypnotherapist will guide you into a state of deep relaxation, often referred to as the induction phase. Induction is the phase where it helps the process by helping you enter a trance-like state. You remain fully aware of your surroundings and in control of your actions, but your mind will become more open to positive suggestions. The therapist may use calming language, visualization techniques, or gentle breathing exercises to help you to relax. Therapeutic work starts once you are in a relaxed state. The therapist will begin working with your subconscious mind. They'll use carefully chosen words and suggestions to help you achieve your goals. For example, if you're trying to quit smoking, they might reinforce the idea that you no longer need cigarettes to feel calm or in control. Post-hypnotic suggestions. With your permission, of course, the therapist may provide post-hypnotic suggestions gentle reminders or triggers to help you maintain positive changes after the session. For instance, they might suggest that you feel a sense of calm every time you take a deep breath. So let's look into some myth-busting moments where, contrary to popular myths, you will not lose control or do anything against your will. You will not bark like a dog, cluck like a chicken, or suddenly develop an aversion to food that you love, unless that's your specific goal. Hypnotherapy is a collaborative process and you're always in charge. 3. Transitioning back to full awareness. After the session comes to an end, your hypnotherapist will gently guide you back to full awareness, which includes awakening. You will not snap out of it like in the movies. Instead, the therapist will slowly bring you out of the trance state, ensuring you feel calm and relaxed. Reflection is a process where after the session, your therapist may ask how you're feeling and discuss the experience with you. They'll explain what techniques they use and answer any questions you may have. Post-session support may include like providing tools or recordings to help you continue the work at home. For example, you might receive a recording of the session or maybe other recordings to help you to listen in between the appointments, the session. After the session, what comes next? Hypnotherapy is often a gradual process and it's normal to need multiple sessions to achieve your goals. Here's what you can expect after your first session. Reflect on your experience. Take some time to process how you feel. Some people notice immediate changes while others may need a few sessions to see progress. Follow-up sessions. Your therapist may recommend scheduling additional sessions to build on the work you have started. Practices at home. If your therapist provides tools or recording, make sure to use them. Consistent practice can reinforce the positive changes you're working towards. Address concerns. If you feel the session did not go as expected or you're unsure about the process, please don't hesitate to discuss this with your therapist. They are there to support you and ensure you feel comfortable. Now that you know what to expect from a hypnotherapy session, let me introduce you to Inner Centering, a groundbreaking program designed to guide you on a transformative journey of self-discovery, emotional healing, and inner empowerment. So what is this inner centering? Inner centering is a powerful blend of hypnotherapy, mindfulness, and heart-centered practices. It's a roadmap to navigating your subconscious mind, healing emotional wounds, and living a life of clarity, calm, and purpose. So core components of the program include accessing the subconscious mind, which is basically diving deep into your subconscious to uncover hidden patterns, beliefs, and emotional blockages. Following that, rewriting limiting narrative and replacing them with empowering ones. So why does this work? Your subconscious mind is the control center of your thoughts, emotions, and behaviors. Addressing it directly leads to profound and lasting change. Emotional regulation through inner centering. Learn practical techniques to center yourself during moments of stress, anxiety, and overwhelming experiences. Cultivate inner peace through mindfulness and self-awareness. So why does this work? Emotional regulation gives you greater control over your reactions and help you stay balanced. Healing emotional wounds include exploring and heal past emotional traumas in a safe, supportive space. Living with presence and purpose. Align with your true self and live with intention. Uncover your core values, passions, and purpose through mindfulness and self-discovery exercises. Living authentically leads to greater fulfillment, joy, and harmony in all areas of life. So why would you want to choose inner centering approach? It's a holistic approach where it combines hypnotherapy, mindfulness, and heart-centered practices for comprehensive healing and growth. The techniques are simple, effective, and designed to fit seamlessly into your daily life, but requires practice. So inner centering is more than just a program. It's an invitation to transform your relationship with yourself and the world around you. Whether you're seeking to heal emotional wounds, regulate your emotions, or just to uncover your true purpose, this journey will guide you towards inner silence, self-discovery, and a life filled with clarity and joy. So if you found this video helpful, give it a thumbs up, share, and don't forget to subscribe for more tips on emotional and mental health, self-improvement, and living your best life. So have you tried chemotherapy or a program like inner centering before? Share your experiences in the comments below. I love to hear your story. Thanks for watching, and I'll see you in the next video. Thank you.